Hi, my name is Maria Williams and I'm with ITK Insurance. ITK stands for In the Know. And this is about being in the know about Medicare. I believe that Medicare is needlessly confusing. But I believe that it's by design because people think it should be easy because it's ABCs. But Medicare is based on the law, it's based on the Social Security Act. So there are a lot of rules and regulations. And that's one of the reasons we created this brochure to help people be in the know so that they can make an informed decision. So, in the inside of the brochure, it is color coded information and helps you understand what your options are. And so, the basic thing to know is that there are two options. You have option one on this side, option two on this side. And then this middle panel tells you the reason for option two. So let's go ahead and get started. Everybody that's on Medicare starts over here, option one. They start over here and they start with original Medicare. What is original Medicare? Why is it called original Medicare? Because in 1965, when Medicare was enacted, it had two parts. Part A for hospital insurance, Part B for medical insurance. So Part A, I made that red because if you're using Part A, you're in the hospital, you're probably not in good shape. So that's probably not a good thing. Red, alarm, alert. Part B is for doctors, outpatient, durable medical equipment like wheelchairs, tests like MRIs. That's Part B. Part B, maybe good, maybe bad, blue. B for blue. So everybody starts with Part A, Part B, and it's good general basic healthcare coverage, but it doesn't cover everything. There's some gaps in it. What do I mean by that? There's things that the government's going to pay and things that the beneficiary you're going to pay. For Part A, there's so much per day that the government pays while you're in the hospital, so much per day that you have to pay when you're in the hospital. For Part B, the government pays 80% of the cost and you pay 20% of the cost. That can be significant depending upon what it is. There are also things that are not covered like prescription drug coverage. So they had to add to the law. So they added Part D, prescription drugs. And that's something that you have to get from an insurance company. So an insurance company, different insurance company offer prescription drug plans. And just to give you an idea of how much they cost, I would say about $30 a month for a policy. Could be more, could be less, but let's just say $30 to have a number to work with. So you have a policy for prescription drugs if you get a prescription drug policy. And I put these little asterisks here because some people may not want to pay for these costs, but if you don't enroll when you're supposed to, there could be a penalty for that. So you've got your hospitalization, Part A, you've got Part B, your doctors and your outpatient services, Part D, prescription drugs, and you also can get something called a Medigap plan or Medigap insurance, Medicare supplement, same thing. What it does is it covers the gaps in Part A and Part B. So your cost. Medigap insurance you get from an insurance company, and that's going to cost you about $100, $150 a month. Let's say $100 a month, just as an average. $100 a month. What's still not covered here? Medicare does not cover dental, vision, and hearing. So if you're used to working for a company and getting commercial insurance, then you're used to being able to go to the dentist and maybe get glasses. Not so much with Medicare. You're going to have to get a separate policy for that. And that's going to cost you, let's say, about $50 a month. Right? Still more cost. Cost for Part B. Part B in 2023 is $164.90. Let's round that up to $165 a month. Some people will pay more, some people will pay less. Most everybody's going to pay the $164.90. The people that pay more are the more higher income beneficiaries. The people that will pay less are people that have availed themselves of Medicare savings plans that most people don't know about, but you can get on a Medicare savings plan based on your income. And what about Part A? For Part A, most have paid that if they've worked 10 years or more, their spouse has worked 10 years or more, they paid that in their payroll taxes. So when you get on Medicare, it's usually covered. So there's not going to be any cost to that. Okay? So that's option one. Option one is you're on original Medicare, Part A and Part B, and you've added to that prescription drugs, Medigap insurance, dental, vision, hearing. What are the benefits to being on staying with original Medicare? Option one is because you can go to any doctor, provider that you want to that accepts Medicare. What are the disadvantages? Is that you have to have this money to be able to afford it. So you have to have the money per month, and you have to be willing to spend that money per month. So now with this Medigap insurance, it's kind of like your car insurance, your homeowner's insurance, whether you're going to pay it whether you use it or not. So this option over here is pay up front. Okay? But if you need it, it's covered when you're on Medigap insurance, right? If you don't have Medigap insurance, there could be significant cost out of pocket for Part A and Part B, your portion of that. So that's option one. And then you have an alternative to original Medicare. This is called option two, the alternative to original Medicare. It's Part C of the law, called Medicare Advantage. When it was originally enacted, it was called Medicare Plus Choice. And what this is a bundled insurance plan with an insurance company where it takes hospitalization, it takes your doctors and your outpatient. Most of the times it will cover your prescription drugs, it will cover dental, vision, and hearing, plus also being able to go to the wellness centers, maybe getting groceries and over-the-counter items. So it bundles all that together. And what is that going to cost you per month? It's going to be a low cost, or there could be no cost to it. It could be zero per month. And so then you have to ask, how is that possible? How is it zero per month when this option over here is costing me and I have to get all these policies? It's because of this. It's because the government is outsourcing their Medicare obligations to private insurance companies for a fixed dollar amount of about $1,000 a month per beneficiary. So I tell people that and they're like, where did that come from? And it's in the Medicare New Book. And this is a book that you're familiar with if you're on Medicare. If not, you can order it from CMS, Centers for Medicare and Medicaid Services. And if you look in this book on page 62, it's just one sentence, but it's there. And it says, that Medicare pays a fixed amount for your coverage each month to the companies offering Medicare Advantage plans. So that's how that option, that alternative, is able to be there for people, because the government is paying that amount to insurance companies. So what's the reason for that? Why would you think that is the case? Why would the government come up with this alternative? Is because if you look at the government cost, they're paying so much per day when you're in the hospital. They're paying so much per day when you go to the doctor. So it's an advantage to them to cap their cost, right? So what is the advantage to insurance companies? Advantage to insurance companies is a whole new market. There are currently 65 million people on Medicare right now. And about 8 to 10,000 turning 65 every day. So that's a huge, huge market. So all those advertisements you see in the latter part of the year, they're for Part C because it's a pretty competitive market, because it's a lot of business that an insurance company could get, right? So you have to think, you see what the advantages are to the government to have an alternative to original Medicare. You see the advantages to insurance companies. It's a new market for them. What are the advantages to the beneficiary? It's a bundled plan at low dollar cost per month. But there is, what I want people to make sure that they understand, and why I put this in yellow, is that you have to go into this alternative to original Medicare with your eyes wide open, because there are costs. So the costs come in having networks that you have to use. Networks are certain doctors and hospitals you can go to. You have to go to. You got to think about that. Why would that be? Because the insurance company has to find a way to control their cost. And they can control their cost by using networks, by negotiating with the doctors and hospitals ahead of time so that they will know how much things cost. So you have to use the networks that are within that insurance plan. And you also have co-pays, co-insurance, and deductibles, which means that you will pay as you go with Part C. Unlike being over here with a Medigap insurance policy, you pay up front at $100 a month whether you use it or not. With Part C, Medicare Advantage, you pay as you use it. So as you go to a specialist, it's $20. As you get an MRI, it's $300. Now, one of the good things that they've included with Part C is this right here, the max out-of-pocket limit. Why is that good? Because regardless of how much you use, regardless of if you have a bad health that year, that's the total amount that you will pay before the insurance company pays 100%. So it could be $3,000, $5,000 a year, but you have a number. That's a very important number to know and to understand. Okay? So those are your two options. Option 1, original Medicare. Option 2, the alternative to original Medicare, Part C. And I added these two here. These are insurance policies. Hospital indemnity, that's an insurance policy you can get to cover you when you're in the hospital, will pay so much per day. And then critical illness, if you have a stroke, cancer, a heart attack, it'll pay you a dollar amount if you have some of those things happen to you. And the reason why I include that, because you need to consider that when you're over here on Part C, because most of your costs, if you reach this max out of pocket, is going to be because of one of those two reasons. Okay? So that's a high level how Medicare works. And then on the back of this brochure is you can take those numbers that I was writing down and you can write down your monthly cost and your annual cost if you're on original Medicare for Part A, B, D, Medigap insurance, and dental vision hearing, and then your annual cost. And then you can take your cost if you're on Medicare Advantage. Now, one of the things I didn't mention, and this is the thing that kind of does confuse people a lot, so I'll go over that really quickly. So even though there's not usually a low or no cost to Part C, when you're on Part C, you still have to pay Part B. You still have to pay that $165 a month for Part B, and that $165 comes out of your Social Security check. So whether you're on this side for option 1 or on this side for option 2, you still have to pay the $165 a month for your Part B. Okay? So back over here, so you analyze the cost. Look at the bottom line. Is what is it going to cost me if I'm over this side for original Medicare for A, B, D, Medigap insurance, and dental vision hearing? Come up with the totals. And then for Medicare Advantage, I still have to pay Part B, so put that down. Part C, you can estimate the cost, but you know it's not going to be any more than the out-of-pocket max. You know that. And then how much is hospital indemnity, critical illness? Look at the totals and compare them and come up with the best decision for you. Why is that important? Because you might think, well, I'll just go back and forth year to year. Not really, because for Medigap insurance, one of the things you absolutely need to know is if you want to be on this side, you need to make that decision early, because you have 6 months after you enroll in Part B in order to sign up for Medigap insurance without them asking any medical questions, called underwriting. If you wait longer than that, then they can ask you medical questions and they can deny you that coverage. So that kind of limits your options, right? So let's just say you decide to be on this side, Part C. Then the thing that someone should be asking you, the thing that you should know, is that you need to make sure your doctors, your specialists, your hospitals are covered in whatever plan that you use. You need to make sure that your prescriptions are covered specifically in whatever plan that you use. And you also, let's just say that you don't, decide to go with Part C, but you end up here. If you have Part D, you need to make sure your prescriptions are covered. So hopefully this has helped you kind of understand a basic overview of how Medicare works and why it's important to understand your two options and to know which option is best for you. If you're watching this on our website, please go to our tab that says one-on-one consultation. We'll be more than happy to help you to kind of see where you are in the process. If you need A and B, to help you know what to do to get A and B, and then help you make an informed decision about which option is best for you, either Original Medicare or Medicare Advantage. Also, if you'd like for us to come to one of your groups, or if you have an organization, we have other presentations that get into more details. We'll be happy to do that. Please don't hesitate to call us. Again, my name is Maria Williams, and you can reach me at 757-933-3688.